How WHO sees the health in all policies approach as a framework in which we'll be able to incorporate interventions, policy interventions that are relevant to influencing the health outcomes across the various sectors, not just in the health sector, but across all different sectors that would have an influence on health status and health outcomes of the people. First of all, we need to identify what their inequities are. So where do we find the gaps in terms of the inequalities, in terms of maybe gender, age, culture, across socioeconomic groups or socioeconomic classes. So we need to find where those gaps are and address them, so that in terms of making sure that these challenges are addressed, that they're addressed in an equitable manner, not just there has to be a comparison, because the inequities may exist not just within countries, but also across countries. And across the Caribbean, there might be inequities that we will find. PAHO WHO has just in 2014 has advocated for the adoption of the Regional Plan of Action on Health on all policies that the member states of PAHO have actually adopted. And we are now in the process of implementing, hoping to advocate for the implementation of the health in all policies approach across the Caribbean and across the region. Right. Civil society plays a very critical role because, first of all, they provide the kind of voice, to those who don't have the voice. It's very important in engaging other sectors who do not have the voice for their concerns to be heard, and that in itself it address the inequities. First thing is getting the evidence out. First of all is to measure where the inequities exist, right? And then from that come up with the evidence, the best evidence that will address these challenges and how you actually address these health inequities. And very important is a monitoring and evaluation framework, where you're able to follow through. And again, you mentioned civil society, because civil society has a role in terms of assuring accountability. That the duty holders who are supposed to carry out what's needed to be done in terms of health in all policies across the various sectors, that they're actually done, and done in a way that would influence positively health status and health outcomes across the Caribbean. The NCDs is a very, very good example, right? Let me just talk about childhood obesity, for example, because if you look at childhood obesity, there are many factors outside of health that influence it, right? Let's say, for example, healthy food options, healthy spaces, open spaces for health activities. You have the role of legislation there, the role of trade in terms of bringing in, the role of parents, in terms of preparation of the food, the role of schools in terms of the food that are available in schools, whether they ban soft drinks or they encourage fruits for snacks, that kind of thing. So there are many other things outside of health where there needs to be some intervention, and NCDs is a very, very good example of where the social determinants of health could be applied, across the board. You know what? Actually, the economic recession actually provides a very good window of opportunity to improve efficiencies and actually implement interventions outside of health, to improve the health outcomes. Because we know that if the burden from NCDs is very high, then of course it impacts on the economic burden of the government. And if you improve the health of the population, then therefore you increase the productivity, and therefore it impacts on the economic productivity of the country. So it's what you call a virtuous cycle, if you engage in the social determinants of health, you're actually addressing, the need for greater efficiencies, and greater attention on what needs to be done to improve the health. And by improving health as well, you improve the economic situation and address the recession. Yeah, the message here is really working together. I think that's a basic message here. It's a whole of society approach, a whole of government approach, a whole of region approach. It's not just one particular sector or one particular entity that is working towards health in all policy. It has to be an all-embracing approach, an all-inclusive, which is a very popular term in the Caribbean, a very inclusive way in which we work together, without excluding anyone. Okay? Thank you.